Today our video will be exploring mental health of Indigenous Australians living in rural and remote areas. The Aboriginal and Torres Strait Islander cultures of Australia are the oldest living cultures in the history of the world. However, despite this, much of the Australian Indigenous culture has gradually faded, and now according to the Australian Bureau of Statistics, Indigenous Australians only make up 3% of the total Australian population. A possible explanation for the loss of culture is due to the stolen generations, which took place between 1910 and 1970. This was where several Indigenous children were removed from their families in the name of assimilation. Due to this traumatic event, many Indigenous Australians experienced, and still experience to this day, loneliness, a low self-esteem, and a loss of cultural identity. Moreover, many mental health conditions, including anxiety, depression, and post-traumatic stress disorder, are becoming increasingly common in Indigenous communities. This demonstrates how significant the stolen generations was on the mental state of those individuals and their families affected. The location of where an individual lives can have a major influence on their health outcomes. Compared to metropolitan areas, those people living in rural and remote locations often have a lower income, lower level of education and employment rates, and finally, limited access to health services. This highlights the scarce services in rural and remote communities where approximately 1/5 of Indigenous Australians live. Hunter discusses Indigenous Australians have higher rates of mental health problems related with this social disadvantage. Hunter further explains in order to address this social disadvantage issue, significant government investment to ensure equitable access to mental health services is available and is extremely important to lead to better mental health outcomes among this population group.
Indigenous bush medicine, or otherwise known as traditional medicine, is a sum of the total knowledge, skills, and practices based on theories, beliefs, and experiences indigenous to different cultures. This method is used by many traditional Indigenous individuals. It is a way where the individual can connect with the land and use its resources for healing. The healing practice includes the concepts of illness and health, the consultative process, diagnosis, treatments, and prevention. Some traditional healers may describe themselves and their practice as incidents involving divination and the extraction of evil spirits. Indigenous culture involves a strong connection to the land on which they live on. As a result of this, Indigenous individuals incorporate their connection with the land into their treatments of illnesses, diseases, and injuries. For example, an Indigenous Australian may believe the land has many great powers to cure mental health problems, so therefore they may avoid seeking mental health services.
Indigenous Australians living in rural and remote areas have many of the same health conditions as Western society, although these individuals have a higher prevalence rate of mental illness, with over half the population experiencing discrimination that has led to feelings of psychological distress. With this significant number, it raises the question of what risk factors contribute to the health status of Indigenous Australians living in rural and remote areas. These risk factors can be described as individual, social, and environmental circumstances. There are numerous individual attributes that can affect this population's health status. These factors can be described as substance use, parental mental illness, and difficulties in communicating from language barriers. Additionally, childhood experiences or traumatic events like the stolen generation, abuse, or loss of a loved one can lead to mental illness in their adult life. A person's social circumstances can also influence the prevalence of mental illness. These aspects include loneliness from being in a rural area, family conflict, level of emotional skills, exposure to violence, discrimination, low income, and difficulties at school or work. The Lancet states that Indigenous children are 2.5 times more likely to be born in the lowest income group. This statistic directly reflects the opportunities that Indigenous Australians have in regards to their healthcare. Environmental elements can be a risk factor for mental illnesses, as poor housing and living conditions can contribute to a person's psychological state. This can be through aspects such as social disruption, privacy issues, noise, and lack of sleep. Shepherd further adds to this by stating the high occurrence of inadequate housing among Indigenous Australians, with the added difficulties in providing and maintaining housing in remote communities. In addition to housing, Indigenous Australians' health is also affected by access to healthcare. Lancet states that 3 in 10 rural and remote Indigenous Australians report barriers to accessing healthcare facilities, such as lack of transportation or limited operating hours. It is further supported by Margaret and her colleagues, who state differences in healthcare that are provided to Indigenous Australians compared to non-Indigenous Australians. Keller and Associates state how Indigenous Australians not only have difficulty in accessing healthcare facilities, but also report experiencing discrimination. This can cause individuals to develop mental health issues after attending such services and potentially avoid health facilities in the future, which can have significant consequences on the management of disease or illness.
There are many barriers and enablers that Indigenous Australians face in accessing healthcare services to improve their mental health, especially in rural settings. Accessibility is reliant on a number of physical and cultural circumstances, including cost and distances to services, perceived ideas and stigma of mental health, institutional racism, trust and cultural competency. A quote by Gibson 2015 ties together some of the underlying needs in the Aboriginal culture, and here it is. Rather than solely emphasising the implementation of evidence-based treatment methods, research suggests that healthcare providers need to also understand health from the perspective of the patient, appreciate the importance of establishing long-term relationships with the community, provide an Indigenous space where patients feel comfortable and cared for, and respect the strong ties that Indigenous people have to family and their land. Indigenous Australians generally live in remote and rural regions of Australia. These areas tend to have a finite number of ambulatory services as well as specialised and acute healthcare facilities. In the paper by McBain, Rigg and Veitch, 2011, their research of the residents of Mount Isa concluded that issues in the community are derived from the affordability of services, costs of travel, and distance in both social and economic senses. Ways in which to enable the affordability and accessibility of health in Indigenous Australian communities is through the provisions of outreach services that can provide transport to these facilities. In the paper conducted by Walkerman, 2008, the Comprehensive Primary Health Care Services is a section of the Aboriginal Community-Controlled Health Services. These services aim to distribute health care to Indigenous people in rural and remote areas of Australia for the past 30 years. ACCHS services were created to prevent the poor access to services for rural Indigenous Australians whom struggle with both the costs and distances of travel to healthcare practitioners. The services aim to enhance the well-being of Indigenous Aboriginal communities by increasing funding and ease for them to become part of the healthcare system. An important aspect impacting Aboriginal mental health is the likelihood of seeking help from trained professionals. According to Isaac's paper in 2010, reviewing a study conducted in Adelaide, suggested that only 14% of Indigenous people who were suffering from treatable mental health issues sought professional help at the time of their suicide. Factors affecting perceived ideas of mental health differ according to each community. For example, a reason for the avoidance of seeking advice can come from an individual's feeling as if their mental illness, such as depression, in some communities, is not treatable and are just characteristics of their personality. Instead, consultation from friends and family is called upon in less severe cases, often going on untreated. Only when the illnesses are more extreme and all alternative pathways have been exhausted is when this population will go to specialists. Furthermore, the stigma associated with mental health, as seen in the general population, creates another barrier to accessing healthcare. In order to influence the perceived understanding of mental health amongst the Indigenous groups is to improve mental health literacy of the community and cross-cultural understanding of service providers. Mental health education of the public and contact with individuals productive in society with mental illness are seen as effective methods to destigmatise mental health. Specific to Indigenous circumstance, attaching culturally appropriate names for health services can help.
Institutional racism has developed underlying discrimination and racism within Australian healthcare, which has created a national system built in a Western framework of health and minimal respect to the varying cultures within. The Western framework focuses on individualism and autonomy of health, while the Indigenous framework is centred around the community as a whole, a communitarian culture, where the health of the individual is ranked less than the community. In the current system, however, there is a severe lack of trust of mainstream healthcare due to discrimination, racism, lack of cultural competency, and underlying issues of previous government policies. which leads to an avoidance or withdrawal of these services. The experiences faced by Indigenous Australians when entering a healthcare facility can be positive or negative in relation to the cultural competency of the service provider. For example, Indigenous Australians prefer to be treated by a healthcare professional of the same gender. Language is also a significant barrier, with the potential for miscommunication of symptoms and feelings. Misdiagnosis of mental health is a possibility. All such factors are examples of how health services are viewed and trusted within a community. There are many ways to improve the trust of a health service. One example is the involvement of the Indigenous community within the mainstream healthcare system. This can significantly enable the accessibility of mental health services for a number of reasons. It can remove misconceptions of the services in the community and provide a point of confidence and identity by clients within the service. The employment of Indigenous health workers can also influence and educate non-Indigenous workers in cultural practices with specificity to the region. This is one example of positively influencing the cultural competency of the service and hence enabling the accessibility of healthcare.
In conclusion, research has shown that Indigenous Australians suffer from a higher rate of mental health issues compared to non-Indigenous Australians. Many issues such as post-traumatic stress, living in rural and remote areas, lack of health facilities, loneliness, substance use, abuse, low economic status, discrimination, and many more are all major factors that have contributed to the increase in mental health problems among this population. As previously mentioned, all these factors can be described as individual, social, and environmental circumstances. Evidence suggests that sadly Indigenous Australians are not rewarded the benefits of the Australian healthcare system compared to non-Indigenous Australians. Furthermore, in order to help change and better the lives of the Indigenous population in Australia in regards to mental health, accessibility to health services in rural and remote areas needs to be improved. This includes enabling factors such as increasing cultural competency, encouraging Indigenous involvement and employment in healthcare, and providing alternatives to elevate the costs of transportation. Thank you for watching our presentation.